Quantum Academy, cellular regeneration and activation of stem cells in anti-aging by homeopathy and integrative medicine. I'm Dr. Farbod, a medical doctor graduate from Shiraz University of Medical Science of Iran. I'm scholar student, class 2024 of the Medical Homeopathy Department at BioQuantum Academy. It's my honor to be the conference moderator from Canada, along with Dr. Otami from Indonesia. I want to thank each of you joining us, all of our speakers, audience members, students, researchers, and our dear guests. Our goal here is to create an open, respectful, and dynamic space for sharing knowledge, insights, and perspectives. Each of our speakers bring a unique background and expertise, and we are excited to hear their views. Today, we will cover key topics such as an interesting topic of activation of stem cells and cellular regeneration by homeopathic medicine, stem cells and epigenetic correction, DNA repair by 528 Hz frequency, and core principle of homeopathy, as well as some valuable researchers presenting by the students of BioQuantum Academy. Please feel free to write your question or comments in the chat or ask at the end of the lecture. With great pleasure and respect, I'd like to invite our honorable chairperson and head of scientific committee of the conference, Dr. Parveen Zareen, open the session with a few welcoming words. We are looking forward to your inspiring thoughts to begin this exciting conference. Dr. Zareen, please, the floor is yours.
Thank you so much, Dr. Farbod. I appreciate your kind words about the Academy, about me, and I'm honored to have you also at my scholars at the BioQuantum Academy and to be a moderator. You guys, all of you, are more than scholars. So you're amazing colleagues, and we learn from each other and we learn together. And thank you so much, Dr. Farbod. That's an official opening remarks from me. Hello, everyone, and warmest greetings from Toronto, Canada to all of you, my distinguished colleagues, my educational collaborators, scholars, graduates, and attendees. Welcome to the BioQuantum Academy Mid-Year 4th International Conference during April 26, 27, 2025. BioQuantum Academy is the pioneer to revolutionize and transform medical system globally. I'm truly honored to be the chairperson and head of scientific committee of this excellent event, and I stand before you who share a common vision and passion for natural healing and holistic well-being. During this conference, we explore the dynamic intersection of the powerful natural disciplines and holistic approach to medical practice. In our pursuit of a healthier world, this conference serves as an innovative educational platform, a melting pot of ideas, and a forum for the exchange of knowledge that breaks the boundaries of relying on one mainstream of synthetic drugs and invasive treatments. Together, we embark on exploring to integrate the best ancient natural modalities and evolutionary modern science in order to treat people. Our platform is where science meets wisdom, where evolving modern science proves ancient philosophy. Our collective commitment to advancing natural healing practice will transform and shape the future of healthcare globally, and inspiring a paradigm shift towards a more holistic and comprehensive approach. We are dedicated and committed to transform the one-sided healthcare system and going to pave the way for a healthier and brighter future for our generation and next generations, because we are very much liable for their natural health and healing. Thank you very much for being a part of this transformative event by your valuable presence and enlightening presentations. Let us begin the 4th International Conference in 2025 by the BioQuantum Academy team. Thank you very much.
Thank you, Professor Zareen, for offering this valuable educational platform, webinars, conferences, workshops for doctors, scientists, experts, and also medical practitioners.
Yeah,
now, I'd like to introduce our first speaker, Dr. Prabu Kumar Raju from Malaysia. Dr. Kumar is a medical doctor, ENT specialist, and surgeon. He specializes in epigenetic correction in holistic wellness and has done research in Malaysia and India of biovibes. He's sharing his research with us today. The topic is stem cells and epigenetic correction. Dr. Kumar, are you here?
Yes, now we see him. Dr. Kumar, thank you so much for joining. And Dr. Kumar is the co-chairperson of the conference, and I would like to ask him to kindly give a few words as opening remarks as well from him.
Very good evening. I think it's morning down there in the European side. So very good morning to all of you.
Dr. Kumar, sorry, we don't have your voice clearly.
It's not clear, is it?
Dr. Kumar, we don't have your voice, and also...
Now is it clear?
Yes, it's better now.
Perfect.
All right. A very good evening to all the Asian country people who have joined this beautiful evening, and very good morning to all the European beautiful souls who have joined for this beautiful conference. Now, the most beautiful part of all of our journey, especially my journey, is joining this academy as a faculty member in the Department of Epigenetics. And it all happened since last year when I presented my first epigenetic information, which I shared last year. And after that, there has no been turning or looking behind. For the reason is, I think from the Biochem Academy, Dr. Parveen felt that this is going to be the future, and every human being needs this particular field of assistance. And that's how this year, 2025, I joined as a faculty member. It's a great privilege that in today's industry of health and healthcare industry, basically, we are all working towards the goal of giving the best to all our clients, be it patients or be it the clients. What we look at is we want to heal them in whatever little ways we are all. Now, if you look at allopathy, of course, it's a beautiful science by itself. But with my experience in this journey as a doctor, I felt holistic approach is the only way. And this particular platform of Biochem Academy, Dr. Parveen and the team of all the, I would say, distinguished professionals who are all here on this platform have the same frequency of thought patterns where the wellness has to be integrated. It is not just one field of way of handling any clients. So in that way, saying that this platform has been a wonderful tool for learning and as well as spreading the information in a much more professional way. And today I'm here in that aspect to present my first epigenetic wellness and the stem cell regulation and the stem cell functioning. It gave me a lot of I would say a lot of enthusiasm because I have been with rabbit stem cell for almost 20 years, and we have been treating a lot of human beings with rabbit stem cells, and we did fantastic results by giving that injection. And then that is how today I'm able to speak on stem cells, but I'm more concentrating on how the epigenetic influences hamper our stem cell regulation, stem cell functioning, stem cell reproduction, stem cell regeneration. All these are playing a very, very important role. So saying that, I would like to proceed further, welcoming you all on this beautiful platform for this 2 consecutive days, which is going to be very, very enchanting and interesting. And I think every one of you will be sitting at the edge of your chair to know what next. So saying that, I welcome you all this beautiful evening and hope you will enjoy this whole lot of knowledge, I would say voracious knowledge, which we are all going to share. And to the students over there, I think with a lot of efforts, they would be here to present their papers and articles and abstracts. So we from the faculty, we would love to listen, hear, and then in whatever best possible ways, we would like to honor you all equally in that situation and learn as well from whatever your research point of view. Now it's going to be a 2-day event. Initially, we all started off with just 1 day, but somehow the response has been so tremendous that we had to make it 2 days. And it's going to be challenging for the eastern side of people to attend the 2 days, because for us now it's already 7 o'clock here. I think the whole program will go until early morning. I would like to sit down and then proceed as much as possible. In spite of our busy schedules, not to worry, we will be there. So what are we here for? We are going to learn. We are going to collaborate. We are going to exchange. We are going to share. And we are going to uplift ourselves through this academic acumen. This is our main goal, main aim. All our clinical acumen from different areas, the different brain is going to be jumbled up, juggled up, and then ultimately we are going to pick all the information and see how well we are all going to practice, implement in our own little ways. Now, I'm going to give this from our integrated medical practice department of epigenetics, and which is going to be a little eye-opener for many of you, as this particular field of epigenetic is still, I would say, in the baby stage, and not many of them are practicing. And it would be nice to see that we are going to recruit a lot more students in Department of Epigenetics, and that will open up this particular field and make everyone understand that this is going to be the foundation for our health. So a little bit about myself. I'm into this medical field for almost 36 years, being an ENT surgeon, which all started in 90s, and then later on went on to learn stem cells, then energy medicine. And today I'm practicing epigenetic wellness, which is my key, and which is my passion, and which is my future. So saying that, it's a little, I would say, a little experience of only 36 years. I feel it's still a long way to go. And I think the next, my target will be 50 years in my medical practice, which will be half a century. But that's going to give a lot of insight towards creating epigenetic modules for the future students, future learners. And that is where Bioacademy is going to be my pillar and my home, wherein from here we are going to open up and we let the whole world be benefited by this epigenetic study, which will happen in the next few months to few years. I'll be there, and then let's learn together. Now, why is this integrated medical practice so important? Number one, if you read this particular statement, it says very beautifully that a good physician treats the disease, but a great physician treats the person who has a disease. Now, this is something very, very important. The reason is most of us, like in myself, being an allopathic doctor, the moment someone joins me and tells me, "Doctor, I have this issue," we jump into finding out a disease. In reality, this particular 10 years of my practice, there is a lot of beautiful connectivity which I created with my clients. I call them as clients. I don't call them as patients, because I don't find a disease in them. I just find there is some metabolic changes which is causing them a problem, and ultimately it has been framed and named as a disease. Now, here, the integrated medical practice, and Dr. Parveen always mentions, integrated medical practice is the choice, and she is bent upon saying that we all have to do this. And she, being an homeopathic specialized doctor, an amazing concept of providing us this platform is the most, I think, the hard work she has put in for these many years to bring everybody, especially people who are all in the same frequency of integrated medical practice, into this platform is something we all have to salute her for her untiring efforts to bring in oneness, and which is through the holistic approach. So thank you, Dr. Parveen. This is a wonderful opportunity. And such a few who are all new to this platform on this particular day of conference, you all have to join us in the academy for picking up the information in various departments. It could be homeopathy, it could be Ayurvedic or any other field. We are all going to join as one, and then we are going to pool in all our knowledge and information so that we all able to pick up the right things and then start moving forward. Now, integrated medical practice is the path of holistic health. Now, this is something which people talk about holistic health, but when it comes up to practically, not many people are practicing. The reason is they've been tuned, they have been conditioned with their regular practice, and for them to get into the holistic approach is going to be a challenging. But with the academy down here, it's much more easier because we have the various departments, so you all can start picking up the information and then start practicing in your own little beautiful ways in your own countries. Now, stem cell, everybody talks about stem cell. I think now in this recent past, everybody is talking. In Malaysia especially, we see a lot of people giving stem cell therapies. It's either autologous, most of the time it's autologous. But for me, I've been trained to pick up stem cells from rabbits. And as of now, it's almost 35 years since our company has been doing this, and there's a lot of wonderful results we have been acquiring. But for me, at the moment I landed up in epigenetic practice, last time in the conference, I was quite surprised when Dr. Parveen was sharing about stem cells and how homeopathic approach could reproduce and enhance the stem cell production. I think I was blindfolded until then, thinking that only what I knew, I was thinking that stem cell could be only through our allopathic way of doing things. But when she said through homeopathy, she was able to enhance the number of stem cells. I said, this is something fantastic. In fact, I was sharing a lot of my allopathic colleagues saying that, hey, I had listened to this doctor and she has been doing a great job. And now, today on this platform, I proudly let you know that every field has its own beauty in their own ways. It can be Ayurvedic, homeopathy, naturopathy, or any field. I think we all work together and then see how we can, improve the stem cell, because the moment we are talking about stem cell, it is the basis of our existence. Without stem cells, we won't be able to move forward. So saying that, how is that it's going to benefit us, and then how is it going to help us through epigenetic? This is through my binoculars of my vision. I'm going to share, and I think at the end of my presentation, you all will understand that this is going to be the pillar for everyone's, whether they have a disease, don't have a disease, but you all want to improve your stem cell, you need to correct your epigenetic factors. Now, going back to a little bit of nature. Now, you all would have heard the word stem. Stem is basically in a tree. There is something called a stem, which is in the center of the tree there. Now, when you look at the picture here, you can see the crown is the top of the tree and the root is the bottom of the tree. Now, without the stem, the roots also cannot pass on the nutrition to the crown of the tree. So now what is happening is, if you look at this beautiful picture, stem is the most important bridge. So for us, stem cell is also the bridge for us to rejuvenate. If you want to regenerate, if you want to recoup, we need stem cells. Now, especially people who are all older, maybe 50 plus, the stem cell production will be less. But with Dr. Parveen and with myself in the picture down here, we can help you to reproduce the stem cells much more easier. You would have seen a lot of people telling you, a person who is 60 years plus, and they will tell, hey, you look very young, Now, what does it mean? How do they look young? But there are a lot of people, when you see them at 40 years, they look very old. Now, why is that? Because the stem cell is not able to regenerate. This is a problem. Now, why is the stem cell not able to regenerate? Probably there are nutritional deficiencies. Probably there are other factors which are affecting them. Saying that, let's go to the basis. Now, stem cell has two functions, very simple. One is, number one, what you're seeing there is, it just multiplies by itself. It has to reproduce itself. It has to produce the same, okay? That is number one. Number two, it has to be able to differentiate into different cells. Now, just imagine yourself when the sperm and the ovum gets connected in a simple man's language. Now, after that, what happens? It's a single cell. Now, after that, what happens? It just starts multiplying. Now, when it starts multiplying, you and me today, we have whole different cells. Now, how is that possible? It's all because from the stem cell, it is differentiated into different cells. Now, that is something beautiful, isn't it? Now, nature has this beautiful mechanism of converting it. But for example, we as human beings, I being an Indian, I cannot become a white man or I cannot become an American. It's not possible, right? That's the truth of life. But inside our cells, stem cells can generate into different body cells according to the requirement. Like, for example, you have an injury in the heart. Now, you need a heart cell. Now, from where the heart cell can produce? To understand the basic concept, your bone marrow is the one which produces stem cells naturally. Now, the moment stem cells comes out, there is a information shared from the cardiac event or the injured cells from the heart. It goes to the bone marrow and says, look, I need some heart cells. So what happens? The normal stem cell will come out, and then once it reaches the heart area where the injury has happened, it converts itself into the heart cell. This is something very beautiful and it happens naturally. So day in and out, we all are having injuries which is happening within our body, but it is all being replaced automatically. Now, only when your stem cell is able to produce and regenerate, you will be able to survive. The day stem cell stops producing, stops regenerating, there is a slow process of death happening in your cell. And finally, we are dead. This is what happens. This is the final stage. So the main two function is, if stem cells are produced, one is it has to multiply on its own. Number two, it has to be differentiated into other cells. Saying that, what are the types of stem cells? To be very simple and precise, there is something called embryonic. Embryonic is something in the beginning. And we have the adult stem cell. Now, with this, there are 4 different types of stem cell. Just for simple understanding, you should be concentrating on the epigenetic influence of stem cell, which is more important. But these slides I'm just sharing because just to take you in a form where you understand much more easily. So there are 4 different types of stem cells. One is the totipotent cells, then the pluripotent cells, multipotent, and the unipotent. Just keep it in your mind. There are 4 different stem cells available for us to redo what we need to. Saying that, what are the types of stem cells which is available right now? From where all we can start picking up stem cells? One is your bone marrow. Everybody knows that. Number 2 is your umbilical cord. Or most of you would have seen that there is umbilical cord blood bank, which collects the umbilical cord from blood from you, and then they preserve it. And then if necessary, they can give it back to you so that you can multiply those cells and then re-inject into your body. Now, there are other ways of procuring your stem cell. Another one is your blood tissue by itself, hematopoietic stem cells. Then we have fetal tissues like your amniotic fluid, then your embryonic blastophore stage, which is also very, very, now these are all a little more, I would say ethically, there is a little hassle we would face. So we are not concentrating on that. But placental membrane, yes, there are a lot of stem cells can be picked up from the placental membrane. Now, very commonly, everybody are doing is the adipose tissue. For this, there needs to be a lab where needs to pick up the adipose tissue, and then we start multiplying your stem cell is what done, but it will be only limited to be producing the stem cells of a limited value and function of those cells. All right. Epigenetic influence is something most of the time, at least for now, I see not many people are looking into, especially production of stem cell, or the dysregulation of stem cell is overlooked. But I'm happy that because of this conference topic, I did go for the past 3 weeks. I've been reading about the influence of epigenetic factors and the stem cell production. So I think I'm very honored to share that this beautiful conference and the academy tickled my brain so that I go deep inside and pick up all the information. And I'm very happy that this is what is going to happen in the future. We all are going to change the epigenetic factors so that let's all produce our stem cells on our own in the way which can help us to regenerate and make you feel young, look young, and all the organs starts functioning in its own little beautiful ways. Now, for those who do not know much about epigenetics, you just listen and record in a way. There are 4 different pathways which happen in an epigenetic factor. If anything to do with epigenetic, there are 4 different situations happening inside. Now, what is that? Number 1 is your DNA methylation. Number 2 is your histone modification. Number 3 is your non-coding RNA. Number 4 is your chromatin remodeling. These are the 4 steps which are happening. Now, don't bother about going into it because it would be very confusing for such of those who are all new to epigenetic. But as we proceed further, why do we need this epigenetic regulation? Now, there are 2 stages. One is in the early stage, especially as a child, before you're born. There are certain things the epigenetic regulation has to be done. And the second part is your adult stage. That means once you're born here and as you're growing, what are the epigenetic regulation? Now, once you read this particular, the maintenance of pluripotence, that means the multifunction has to be maintained right from the embryonic stage until the fetus, until the baby is born. There are certain things has to change and then they wait. That means they have to be inactive until needed. For example, if the stem cell has to go near the heart and then wait until it needs to be changed at the heart cell, or if it goes to the liver, it just goes down there and waits until the liver starts forming and it converts into liver cells. Now, this is something very beautiful. It's all done like as you switch on the lights wherein you can switch it on and switch it off. The same way, our epigenetic expression is also switched on and off. Now, the second part of it is your stem cells differentiation. Now, differentiation also involves a lot of epigenetic program. Now, just imagine as a human being, we are down here, there is a webcam here, I'm speaking, you people are listening to me, and there is a connection, and there is an online Wi-Fi with me, and then we are able to see, I'm able to speak, and you're able to see. But inside our body, there are a lot of situations which is happening in and out without your knowledge, especially your stem cell differentiation. It's just happening in and out. Your DNA methylation is just happening. Your histone deoxy, everything is happening, but we do not know. What we know, we just eat our food, it goes inside, and after that we sleep, wake up in the morning, we do our job. But there are a lot of factors, there are a lot of mechanism of action which is going on inside. Now, when you realize this, our human body is the most complicated machine in the whole world. And for us, even with the AI technology, we won't be able to reproduce the same way as a beautiful human being. We will not be able to do that. We may probably nearing to a human being. In fact, today morning when I was discussing about AI technology, there was a situation where it was discussed that AI could do cardiac surgery. So what happened? Everything robotic. But finally, what happened was they had a complication and the patient died. Now, this particular information is not shared anywhere outside, but this happened. Now, what happened? After the AI technology with the robotic situation, they left it to the robot to do everything. But finally, it couldn't do. Why? Because during certain situation, you need a human brain. You need to think and then see immediately you need to act. For this, nobody can replace your human brain. So, however, our AI technology with the latest situation, I would request all of you, you do not be dependent on AI technology fully, but start using your brain in a way you start functioning and you have to do things on your own. That is when you will start expanding. Now, what is happening is with all the technologies, we all are actually becoming redundant. That means we don't want to do anything on our own. We just press the button, we want the things to happen. You should not get into the total automated situation as a machine, because we are not machine. So saying that, this is the epigenetic early regulation. So now what happens in an adult? Also, their needs, like you and me, we are all adults here. So what happens is we all need to have some kind of regulation, and epigenetic plays a very, very important role in its production. So what are the ways, right from the bone marrow to the skin to the intestine to the adult stem cell in the muscle, then self-renewal, differentiation, it's all happening. Now, aging also affects our stem cell production and the regenerative capacity for every cell for it to reproduce. Also, there is a problem. Now, with all the technologies, with all the food habits, with all the environmental factors, it is a challenging situation for every human being. But with the challenges, I would say we will be able to do it with the proper guidelines and proper care of whatever food we are talking. We should be able to handle to reproduce our stem cells in a way it has to be produced naturally. Now, stem cell dysregulation, that means where all the situation, in fact, I have more than 120 factors, but today I've just picked up around 4 to 5 of it now, which is very, very important for all of you to understand that if you can just concentrate on this itself is good enough for you to be healthy and then able to produce your own stem cells in the way it has to be done naturally. Now, there is something called methyl donors in this epigenetic practice. Now, what does it mean? Methyl donor is you need a methyl molecule into your cell, wherein what are the methyl donors? If you look at on the left side of my slide, you can see folate. It's just B9. Number 2 is your B12, methylcobalamin. Previously, it was cyanocobalamin, which was very famous, but now people have started using methylcobalamin. Why? Because your body need not convert from cyanocobalamin to methylcobalamin. So we make our body easier to use the methyl portion of your B12. Then we have the betaine. Then we have methionine, which is also very, very important. You won't believe 10 years ago when they were talking about methionine cycle, even though I have studied methionine cycle in my biochemistry in my first MBBS, long ago, I don't remember anything. But the moment I started going through the cycle of methionine cycle, I found that it is such an important metabolic pathway, and it is the most ignored pathway in our journey of life. We hardly even look into it. And if anybody is going to talk about nutrition, and if anybody is going to talk about vitamins, what happens? Most of the time in allopathy, what will say, no, not necessary. You don't need vitamins. You don't need to take all this. This is how we have been trained to talk. But today, without all this nutritional support, I am not able to move forward. So saying that methionine plays a very important role, choline plays a very important role, B6 pyridoxine plays a very important role, then SAM plays a very important role, and finally zinc and magnesium. Now, these are all methyl donors for your metabolic function. Now, saying that, if this, there is a problem, for you to understand a little more, there is something called DNA methylation. So for you to understand what is methylation is, as long as the methylation process is happening in your body, you're alive. That means the cells are able to live alive. The moment methylation stops, that is the time your cell also will die. After that, they cannot reproduce. After that, they cannot be able to regenerate it. So methylation is an active process. It will happen as long as you're alive on this planet Earth. Methylation process is a must. Now, it can be a hypomethylation or it can be a hypermethylation. Both is a problem. If it is hypo also is a problem. If it is hyper also is a problem. Now, saying that, most of the time, today we can see a lot of people talking about anti-aging, but I don't use the word anti-aging. I use the word graceful aging, because anti is opposite of aging. Can we all stop our aging? No. We all will age one day and then leave this planet Earth. So graceful aging plays a very important role. So in that, when we look at the methyl donors, it helps in your detoxification, reducing your oxidative stress, and support in your neurogenesis. These are all little functions. Let's not go into the detail. Now, B9, most of the time, B9 is folic acid. When did you take your B9 tablet. It will be 99.99% when you're pregnant. Doctors will give you iron and a little bit of calcium and B9, folic acid. Especially the moment they know that you're pregnant, early pregnancy, they will put you on B9. But today, you won't be, I would say every one of you be surprised that every 10 clients I see, 7 to 8 clients will have folic acid deficiency. The moment folic acid deficiency is there, that means there is a problem in the methylation. There is a problem in, but they will have diabetes, they will have maybe high blood pressure or any other problem. But when you go deep inside and see, it forms a very, very important pathway where that deficiency causes a lot of issues, which later on becomes a disease. So now can you see here, there is something called stem cell differentiation happens when your B9 is given to the body. Now, if you do not have sufficient amount of B9, what are the problems you can have? One is your DNA synthesis can be a problem. Number 2, methylation problem. Number 3, stem cell differentiation. Then nerve development. Then hemopoiesis. That means your blood production. All these are affected because of this one vitamin called B9, which is nothing but folic acid. In fact, there are a lot of times when I ask, especially doctors and other people, what is B9? Everybody will be just, gazing and saying they don't know what it is. But the moment I say it's folic acid, then things becomes easy. Now, folic acid is nothing but B9. This is how many times I myself learned a lot of things in this epigenetic practice. But this is the field which I think every one of you would love to join and then start learning and then exploring much more deeper. So for you to understand, can you just see the methionine cycle? It converts to homocysteine. Now, many of you would have seen that when you do a blood test, doctors will ask you serum homocysteine levels. Now, how much should be the serum homocysteine levels? It should be less than 3. But if it is more than 3, that means there is a problem in this particular cycle. And when you go deep inside and see, they will be having deficiency of B12, deficiency of folic acid, and betaine. These are the 3 very, very important factors for it to convert to methionine to homocysteine. Now, if too much of homocysteine, what happens? It's an inflammation. If there is an inflammation, what happens? That leads definitely into a disease process. Now, imagine if there is an inflammation in your heart, maybe in the vessels, what happens? You are eligible for a heart issue. It can be called as a heart attack. Now, how do you reduce your inflammation? There are a lot of factors we need to look into, but just for your understanding, it's just the 3 very important nutrients I'm talking about. It's your B12, it's your folic acid, and your betaine. Very, very important. It plays a role in, finally, from methionine, if you go down deep, the final product you get is glutathione. Now, glutathione is the mother of antioxidants. Amazing, isn't it? Now, you want glutathione, you need to have this beautiful cycle in alignment. The metabolic process must be well balanced. So you need all the nutrients for your glutathione production. And today, there are a lot of free radical damage. You know pretty well it's happening. Now, glutathione is the only one which will be able to bring down your oxidative stress. It's a mother antioxidant. So that means you need to have a lot of glutathione. So today, if you see in all the wellness industry, people are using left and right your glutathione. There are a lot of capsules available, injectables available. So what is happening is externally we are trying to take, but still, if you all can produce it in your own way through the natural method, it will be just fantastic. Saying that, the next very important, heavy metals. Now, what are these heavy metals? Very simple: lead, mercury, cadmium, arsenic, and aluminum. These are the 5 major, but there are a lot of other heavy metals not bother about, because in my practice, I see these are the one which is very, very important for you to understand that it can affect your stem cell production. Now, when you look at the heavy metals, it does impair, and there are a lot of genetic instability it can cause. And not many of us realize, not many of us detoxify ourselves from heavy metals. We all know there is heavy metals in our body, but are we detoxifying? No. So you all have to look into detoxifying your heavy metal if at all you want your stem cell. Now, why do I say that? If you do an analysis of heavy metal analysis of 10 people, I would say 8 to 9 people definitely will have heavy metal, which is not good. The reason is the collection of heavy metals, especially mercury. Mercury is supposed to cause a lot of issues related with your brain. Now, if you see Alzheimer's, Parkinson's, dementia, I'm just mentioning 3 diseases. Invariably, 99.99%, they will have mercury poisoning. That means the mercury levels in their system will be very, very high. Now, there are 2 things you need to understand. One is at the tissue level, one is at your blood level. Maybe many times when you see in the blood level, it will be normal. That means what I'm mentioning is your heavy metal. But you need to go to the tissue level and then get it tested. That is the much more accurate form of understanding the heavy metal. How much is it in your tissues? So heavy metals plays a very, very important role in your, how does it affect? Now, very simple. If you have heavy metal in your body more than required inside your cells and the tissues, number 1, there will be oxidative stress. Number 2, epigenetic disruption will be there. Number 3, there will be a damage to your DNA, and that in turn will lead to genotoxicity. I will just give you one example here. A smoker, a person who smokes, in this life, probably he may not have any problem, probably. But his 3rd generation or the 4th generation will have the effect of the smoking at the DNA level, and those, maybe your great-grandchildren, will be having a problem. Now, just imagine today's people are very happily smoking away, and they think they're doing some big favor to this environment by smoking. And if you ask them, why do you smoke? They say stress they would say stress as one of the reasons. But if stress one of the reason and you smoke, maybe as doctors, we all will prescribe you maybe 10 cigarettes per day, 3 times daily. We can prescribe, right? But we don't do that. Why? Because there are a lot of harmful effects. So now the question is, you do not have any rights to transmit or transfer a diseased 3rd generation of your own generation, but the 3rd generation will be affected. But that time you may not be even alive to see your grandchildren, whether they are having any issues or not. But today, commonly, if you see, there are a lot of children with autism. There are a lot of children with Down syndrome. So we do see that. Now, if you see, as a doctor, I will just jump into, okay, Down syndrome, this is what we are going to do. But if you just go back and see, probably her great-grandparents would have done something, and that's how the genetically it has been modified. And today that child is born. She is not wrong. But what to do? So in that way, there are a lot of interferences in the signaling pathways and mitochondrial dysfunction. Now, this is something I want to be very specific. Today, we see a lot of mitochondrial dysfunction in my day-to-day practice. And you know what is one of the deficiencies? Manganese deficiency is one of the reasons for mitochondrial dysfunction. So heavy metal plays a very, very important role in your stem cell production. So with all these, your stem cell production definitely will be less. So which is not good for you. Now, this is something you all will be very, very surprised that parasites. Now, what do we do? You and I, as in a common situation, what we would have done, we would have been given deworming tablet when we were as a child. None of the adults would even look into or think of taking anti-parasitic tablets because we don't feel that. But let me tell you, with my epigenetic practice, it has become a regular routine that any client who comes, I will actually deworm him first. In fact, that is my first line of management. Now, why do we do that? Because parasites causes mitochondrial dysfunction. Number 2 is stem cell signaling irregularities is being done by parasites. And then bioenergetic imbalance, especially in your gut. It is something very, very important, but we do not know because we don't feel it. And gut dysbiosis is another very important factor where your stem cell production will be affected in your intestines. If your intestine is not regenerating stem cell, and if your intestine is not having fresh stem cells, what will happen? It becomes so old that it is not able to. You would have heard the word called leaky gut, right? Now, leaky gut also is a situation where, because of heavy metals and because of parasites, that is the reason today we need to deworm ourselves regularly, especially every 6 months will be very, very important. Now, this is another word which you would have, heard from people. And this particular word is very commonly used by non-allopathic doctors. It can be from homeopathy to Ayurvedic to naturopathy. They talk a lot about inflammation. But now in epigenetic, I talk a lot about inflammation. Now, inflammation plays one of the important role in your day-to-day stem cell activity. Now, the number one cause, stem cell exhaustion. If there is a persistent inflammatory signal, it will overproduce stem cell, and then a stage will come that the body is producing so much of stem cells to regenerate. Finally, there are depletion of stem cell. It can happen over a period of time. That is why you would see a lot of people, they are 40 years, but they look 60 years. They look very old. So they are aging very fast. Now, why is that? Because of the inflammation. So your own body is trying to balance it. So like that, when you look at chronic inflammation also, now this is something acute inflammation, then we have something called chronic inflammation. That also plays a very, very important role. What is happening is most of the diseases, especially your diabetes, your granulomatous diseases, all is because of your chronic inflammation. Now, chronic inflammation also will affect your stem cell. Other than that, if you go a little lower down, you see a lot of epigenetic changes. Now, inflammatory cytokinin, which actually causes a lot of DNA methylation and reprogram. Today, if I have to give you the best example I can give you is after the vaccination, you see a lot of people having many issues in terms of autoimmune diseases, cardiac events, and cancer is quite rampant now after the vaccination of the COVID vaccination. Now, what is happening here? It's all the inflammation which is happening inside our cell. It is just exploding and causing a lot of problem. But today, focusing on the stem cell, it does affect your stem cell. And inflammation also will affect your DNA, it damage, and there is mutagenesis. So there are a lot of problems which can happen in terms of reactive oxygen species. Now, these are all very detailed things. Let us not go into too much of detail. Inflammation causes a problem in your stem cell production. So we need to bring down your inflammation. All right. Now, saying that, just this is the final stage where I'm going to go a little bit so that you understand how does epigenetic work. Epigenetic works is from the input. What is the input? Is your environment, nutrition, and the medication what you all take. It gets inside your body, and the body, there is an integrated system. There is a response. So that is how the response is from your DNA changes, your gene expression, and the effect of every molecule in your body start affecting. And then over a period of time, there is something called a disease happens. Now, what should we do? We need to get into the practical approach of how do we handle the epigenetic factors? How do we recognize the epigenetic factors? We need to do that. So that is where we have our Bioquantum Academy. And there you have a department called Epigenetic Department, and I am heading the department. So you all have a wonderful time so that you can pick up all the information and then move forward to learn what is epigenetic. So just to give you a little more highlight of it, there are 800 factors which affects your epigenetic. Now as of today, we are able to pick up 200 epigenetic factors, and that is two different testing methods, which I'll be just sharing you in a while. So how many cells do you have? 50 trillion cells. Amazing, isn't it? Now, how healthy are you? What do you mean by healthy? Healthy means if you can heal thyself is nothing but healthy. Now, what should we do? You must support the epigenetic pathways to the cell. Very, very important. Whether it is a stem cell production or whether it's for any metabolic pathways of your cell, you need to correct it epigenetically. That is when you will become healthier. Saying that, what are the technologies available? Number one, the first technology right now for an epigenetic is your hair root analysis, which we can do it. And then from there, you can pick up all the epigenetic factors and we will be able to give you all the information. So I have done almost more than 10,000 tests in Asia for the past 10 years. And we are right now around 50 doctors in Malaysia. And I'm the first Indian doctor to start practicing in India. So saying that, what did I find? I found that the underlying cause of a disease is toxic metals, your gut bacteria, then metabolic imbalance, food intolerance, vitamin deficiency, amino acid deficiency, fatty acid deficiency. These are the main. So the moment we start correcting it, everything starts playing a wonderful role of recouping back. So the clinical application of epigenetic for natural stem cells regeneration is going to be the future, and we all have to work towards how do we correct the epigenetic factors and move forward. Now, what is epigenetic? Epigenetic is a precision medicine, hence requires a lot of clinical correlation and the cell function. You saw the way I spoke about the methionine and its conversion to homocysteine. This is how we go. We take a binoculars and go inside and then see, and then we pick up the situation. So now you have an opportunity. Pick up the information and you all can do it. And we are here to assist you to pick up the epigenetic knowledge, and we would like to share that. And then from there, we will be able to not only stem cell, overall general health, you should be able to do that. And this is going to be the future. I always say epigenetic correction is a must for everybody, be it a child or be it an adult. You may have a disease, you don't have a disease, doesn't matter. You need an epigenetic analysis and epigenetic correction. So what is the steps? There are 4 steps. One is your gut clearance, then the gut support with food avoidance, nutraceutical support, and then relevant blood testing we will do to do the epigenetic correction. Saying that, finally, epigenetic correction is the first step for today's topic of stem cell enhancement. But finally, when all this is done, your body is healthy. When you're healthy, your mind also can keep it healthy. Then your soul is healthy. And finally, what will happen is we all can move forward and live a beautiful, healthy lifestyle. So at the end of the day, wishing all the wonderful souls who are attending this conference and all the faculty members who have put in an effort for the past 1 to 1.5 months to bring this conference to this level of success. I appreciate, I congratulate, and I salute every one of you for putting your untiring efforts, and to the speakers who are going to give us more. So I'm excited. I'm going to wait for all our students and speakers. So wishing you good luck and prosperous new year ahead. And thank you so much. And finally, not last but not the least, I look forward for you all to join us, this Biochem Academy, in the Integrated Medical Practice Department of Epigenetic. Learn and explore, and then move forward, and then, be in that frequency of epigenetic, and then every cell of you must speak epigenetic. And then finally, you should show them that when you are healthy, you can make everyone healthy. So let's all work together. And thank you all for this wonderful patience in listening to me, and looking forward for the other speakers to move forward. Thank you very much, and have a wonderful morning there.
Thank you, Dr. Kumar, for your insightful presentation. Your expertise added tremendous value to our conference. Please let us know if there are any questions about this topic, as well as we have a question in the chat.
Yes.
Could
you please read the question to Dr. Kumar? As actually I heard, he answered this question right at the beginning of his presentation. Maybe
yes.
Dr. Bayu just missing it, but please read the question to Dr.
Sure.
Kumar again.
How do epigenetic mechanism regulate stem cell self-renewal and differentiation? And what are the implications for regenerative medicine? Thank you.
All right, as I told you, there are almost 200 factors.
Sorry, Dr. Kumar, we don't have your voice clearly.
Earphone, because I thought I need to listen to the question. All right, now very important is, as I told you very clearly, that there are almost 200 factors we can pick up. And today I just discussed just 4 factors. Number 1 is your methyl donors. Number 2 is your heavy metal. Number 3 is your parasite. Number 4, parasite, and then finally inflammation. Now, if you put everything together, there are around 120 factors which we can pick through your hair analysis. We can pick it up. And there is another instrument I didn't mention. It's called bioquantum analysis, which is also using bioresonance. Now, all these factors not only affect the process of methylation, the process of regeneration, but when you look at the stem cell, they are also affected very, very effectively. So here what happens is you need to do the epigenetic correction. Now, there are a lot of other ways of, stem cell production, where you can actually increase the stem cell production from the bone marrow through natural means. There are vegetable capsules available from USA where you consume the capsule and it produces 4 times the stem cell production by your own body. It is there. But there are a lot of different methods. But what I would prefer would be is first rectify all these basic things. Even a parasite can cause a problem for you to, to reproduce, or maybe your stem cell production can be affected, as I told you. But all these information, when I start my modules in epigenetic, we will go very deep inside and show you how stem cell production can be affected and how do we correct it. So ultimately, picking up the epigenetic factors plays a very important role. That is number one. Number two, analyze the epigenetic factors, and then we can correlate it with the stem cell production and then correct it. Now, then we can go for the external factor or the internal factor of production of our stem cells. This is how we need to go step by step.
Thank you.
You're fascinating as always, Dr. Kumar. And one thing that I would like to mention that always Dr. Kumar says, don't blame genetics, because epigenetics is about that. And correct your epigenetics, correct your lifestyle, get close to the natural living. And whatever Dr. Kumar said, these are all the factors of epigenetic. Then actually, exactly what he said, Dr. Hennemans, the father of homeopathy, said the same thing. That homeopathy is a genius system of medicine. It's an intelligent system of medicine, but cannot do miracle if there are epigenetic factors around you. It hits the wall. That's why I always say, that's why my modality with Dr. Kumar's modality are so compatible, to the point that health and healing can be restored so quickly, because do not blame genes all the time. So, and epigenetic is, there are a lot of different factors that he just mentioned. So correcting those, I think healing is on the road. So, and a little bit of medicine here and there. There are times that, even though I'm a nutritionist, I'm a homeopath, I'm an integrative practitioner, but there are times that the patients come to me, or as Dr. Kumar said, the client comes to me, and I said, listen, you don't need medicine. Just follow this, the lifestyle, and you're good to go. And that in 3 days, 4 days, they call me that they are 85% better. So that's how it is, epigenetics. And don't blame genes all the time, and don't blame your parents all the time because of passing the genes to you. Dr. Kumar is there to teach you who is to blame. Ourselves. Who is to blame as ourselves. So it's amazing. Dr. Kumar is having webinars, throughout the year on epigenetics. He had one fascinating just a couple of months ago, and you're on track. And as he said, he's the head of the epigenetic department as an integrative medicine. And reach out to us if you want to take his full course, or even the diploma programs in integral approach that is based on epigenetics. We have certification titles for it as well. The certification titles falls into lifestyle practitioner or natural therapy practitioner with epigenetics. And if you like to know more and even have diploma programs, so Dr. Kumar is around. So thank you so much. Appreciate it. And it was fascinating as always.
Thank you. Thank you for the clarification and nice words. And please let me introduce our dear second speakers from Canada. And all her, but let me introduce him formally. Professor Parvin Zarin is the president, dean, educator, and founder of Bioquantum Academy and international educational platform of homeopathy and integrative medicine. She has a doctorate of natural medicine. She is an international classical and medical homeopath educator and also head of departments of medical homeopathy, integrative medicine, nutritional science, and biocosmetology of BioQuantum Academy. Her discussion today is the topic activation of stem cells and cellular regeneration by homeopathic medicine. Welcome, Professor, and we very much look forward to hearing about these important subjects. The floor is yours, please.
Thank you so much again, Dr. Farbod. You're such a great moderator. Where have you been
Thank
for
you.
all
My
those
pleasure.
years? And we missed you.
Thank you.
Thank you so much for your wonderful and kind introductions, as always. Again, welcome everyone to the BioQuantum Academy 4th International Conference on April 26 and 27, 2025. Today and tomorrow, we're going to make everybody at least 10 years younger. And with just talking, because sometimes talking works like medicine. So I would like to ask everybody who you all see my slides. So can I start?
Yes, please.
Okay, I think Dr. Farbod already introduced me, and thank you so much. Yes, my talk is going to be on the activation of repair system or stem cells by natural and holistic methodology, which in my domain is homeopathy and nutrition and integrative medicine. So this is a big topic, and when you open online, Google, YouTube, and everything, it's just videos and articles popping up about stem cells. But the stem cells, we are born from it. We are stem cells. And if something is new to the science of biology for the past just 23 years, it's been around 1,000 years ago with ancient scientists. So, which I'm going to walk you through everything. So the presentation outline, I hope that I'm going to have time to cover everything, because this is a 20 hours of course, a stem cell course at the biocosmetology department. But I have to kind of condense and kind of summarize it in just 45 minutes, or if Dr. Farr would allow me a little bit more. But again, I don't want to miss any major points. But again, these are the outlines of the course, but I'm trying to be as fast as possible. So the outlines are about the endogenous stem cells activations, which is my area of talk, and exogenous stem cells therapy, which is not my area of talk, but I'm going to mention everything. So I'm going to talk about somatic cells regeneration and stem cells regeneration, because we have two regeneration system in our body. We are born with it. We are endowed with that regeneration. So when it comes to aging, aging is not just the simple wrinkles or just the gray hair. Aging is much deeper than that. It goes at the cellular level that is deforming, and such as bone loss, such as muscle atrophy, such as loss of elasticity of connective tissues. These are what I'm talking. Aging is the process of chronic disease, and aging is a form of degeneration. Do we have to age? Absolutely not. And I'm going to walk you through. I'm going to talk about the aging and anti-aging. Anti-aging is not my, preferred terminology, but because it resonates with the almost everyone, so I use it, exchangeably with regeneration as well. These are two poles of one phenomenon, and so I talk about aging contributing factors and anti-aging contributing factors. and goes on with adult stem cells, bone marrow, red bone marrow versus yellow bone marrow, and why in the decade of 30s, our red bone marrow is going to convert to yellow bone marrow, and we're losing 50% of our stem cells. But what we have to do to make the stem cells regenerate quicker and faster for us. So I'm going to talk about the growth factors and signaling messaging pathways, which are the main part of my talk, that these are the ones that they're going to release the stem cells from our bone marrow. And I'm going to talk about it, how homeopathic medicine can do that for us. And I'm going to talk different types of stem cells and functions, and goes on and on. And if you want to take a photo and a kind of screenshots, you can take, because I don't want to miss the main part of my talk. So let me just introduce myself a little bit in terms of, you know, I'm not saying I'm a scientist, but I can easily say I'm a philosopher. But I share my views, I share my perspectives based on my philosophy, based on my scientific view, based on my research, based on my clinical practice, acknowledgement, and personal experiences that I had through the last 3 decades of my practice and my life. There is one question. No matter, we are all individuals, distinct individuals. We are all having different perspectives, different views, different lifestyle, different backgrounds, different medical practice, and everything else. And there is no 2 fingerprints are the same. We are so individual, but we all collectively agreed on something, that all the sciences, all the researchers, and everything is going to do something about it. Nobody wants to age. No one wants to age. And everybody says, what do we have to do to reverse it, to prevent it, to stop it? What do we have to do? Isn't it true? This is something that we all are here to make it happen. And we are so many different, as I said, in so many ways, but we are the same on one thing. What is the reason that nobody wants to age? Because age is not a natural phenomenon. Age is a degeneration. Aging is a cellular degeneration. I'm not saying about graceful aging that Dr. Kumar just mentioned. It's absolutely great terminology. We can use it. We all are growing older. I use it as a growing older with different stage of life. We need, you know, it's something that we need now, we might not need in 10 years. So that's how the nature is endowed in us to go according to the growth older. But I'm not talking about the chronological age, about the number of your age. I'm talking about your biological age. So a biological age is based on so many different things. As just Dr. Kumar said, epigenetic factors are playing a huge role in your biological age as well. We want, on this platform, we want to teach how you can make your biological age functioning properly, not chronological age. Okay? Aging is not following the natural laws and principles. Actually, it's opposite of natural laws and principles. We can live 100 years, 200 years, but not degenerated. We can grow older, we can change structures, we can, the level of hormones, enzyme, and everything changes, but we don't have to be degenerated by the time, from arrival time that we are born to the departure time that we leave this existence. We keep regenerating, because regeneration is endowed in every single cells of human body, the same as nature. Nature has laws and principles and goes accordingly. We had such a harsh winter in Canada. We had the Canadians, that 4 of us in this house is on this conference, we are Canadians. We know that how harsh the winter was. The snow was sometimes up to shoulder in some short people. But all of a sudden, the snow are gone, melted, the green is coming out. So winter turns to spring quickly. It's a regeneration policy. It's a regeneration laws and principles of the nature. And human being is an absolute part of nature without exception. So growing older is a natural phenomena, is a natural process, but with regeneration, not degeneration. So aging simply means degeneration, and anti-aging simply means regeneration, means activate the regeneration. So aging is much deeper than that. Okay, my view on aging or anti-aging or stem cells and everything is not a copy-paste of anybody. It's my research, scientific research, it's my clinical practice, my personal acknowledgement, individual experiences, and my holistic medical perspective and my philosophy of life. So, okay, human, as I mentioned, has limited time from arrival to departure. I'm not talking about lifespan. I'm talking about health span. The lifespan is not in my hands. If anytime cosmos, the universe wants to take me, will take me, no matter if I'm healthy or I'm sick. But if I'm sick and I die, is an artificial death. It's different than natural death. Everyone wants to have a natural departure. That's what I'm talking about. We have limited lifespan, but unlimited health span. From this time to this time, arrival to departure, we have to keep healthy. We have to keep renewing because we are endowed with that power. That's a healing power we have. So this is the main, my main perspective. If we regenerate as the nature endowed in us, but why aging? We have defense mechanism, defense system, we have repair system, we have regeneration system, we have regeneration organs such as liver, we have regeneration hormones such as IGF-1, GAG, we have regeneration program. We are programmed to regenerate. We are programmed to have renewal cycle. And we have regeneration pathways all over our body. But having all those above abilities, why aging? Aging is not endowed in us. And I can challenge whoever said aging is natural. So I would like to start with a quote of, we are where a modern science proves ancient knowledge. Knowledge is existed from the beginning of life, so is the stem cells. Knowledge is endowed in nature and human is absolute part of nature. Only the method of downloading knowledge is discovered by humans. So the knowledge is being endowed within us as soon as we are conceived. The knowledge of the cosmos is within us, but who is downloading it, processing it, and applying it? We call them scientists, right? So, but the knowledge is not created by anyone. It existed from the beginning of life. So that's why whoever is downloading knowledge is going to share it and put it in the pool of knowledge. Science must be applied according to the nature's laws and principles, and deviated science is destructive to mankind, and we have seen it over centuries. So I think I mentioned that aging simply means continuous cellular degeneration, and anti-aging simply means continuous cellular regeneration. These are two opposite, extreme opposite poles of one phenomenon. So if you want to understand how to regenerate, you have to understand how the body degenerates. So these are something that they are entangled. Okay. So as I mentioned, we are mortal. I don't want anybody to challenge me because I have been presenting on so many different settings, so many different platforms about quantum anti-aging, about the stem cells, about regeneration, about all this. But some doctors, they want to challenge me, and I'm ready to challenge. That you mean we are immortal? Absolutely not. That's not. I mean the health span. We all are mortal, but the health span is the key to keep your life according to the natural process. Since the beginning of life, every, the sciences, every religion, everybody, people wanted to feel better. They want to feel, they look younger. And they all look for different medications. They all look for different techniques. And now, the last 100 years, there's so much invasive treatments around that it's very critical. We are getting into critical stage of, life and natural life, which we have to bring awareness to doctors and to everybody that what it is. So aging is not just superficial wrinkles or loss of hair pigmentation or gray hair. It's much deeper. You have to go at the cellular level. It's a degeneration. Degeneration starts at the cellular level. We don't have functional aging. We don't have functional disease. Everything is cellular. So if the cells are hungry, they are deficient chronically, if the cells are intoxicated chronically, if the cells are not producing an inadequate energy from mitochondria, the cell is going to, DNA of the cell is going to be mutated, aged, and dead. This is so simple. I'm talking about the somatic cells, because we have two different regeneration systems. There is one somatic cells regeneration that they have their own renewal cycles. They are programmed, they are differentiated, they're a specialized cell. They know what to do. Nobody should tell them to do nothing. They know everything according to their programs. But their stem cells are undifferentiated. They are blank cells, and they are sitting in our bone marrow and fatty tissues to be called. They're uncalled. So how do we call them when we need them? That's a key to understand how we can regenerate. Calling them is a huge task for the body. Somebody has to come to help us. We need helpers. So that's why homeopathy is coming to help us to call stem cells. So I don't want to get into the somatic anti-aging so much, because I want to get into my stem cells regeneration more, but I have to walk you through in the somatic regeneration as well, but quickly, because to distinguish, to know that what's the difference between these two systems. The system that are programmed for regeneration, the system that are not programmed for regeneration. We have to call them, guide them, direct them for regeneration. So these are the two systems I would like to go through. So we are not talking about the method of temporary superficial corrections that a lot of clinics are doing. Those are for the beautifying people. I'm not against that. Beautifying people as long as you don't harm, but those are not the actual anti-aging or regeneration. Regeneration is at the cellular level. So these are two major talks that I said, one internal stem cells activation and external stem cells therapy. External stem cells therapy is not my area, but I would like to talk about it, that how invasive can be, and how unethical can be, and how risky and dangerous can be, and how costly and expensive can be. And when we have the ability to do it on our own, our cells can do it, why not to do it on our own and go and rely on that? This platform is based on this, to bring you out of this, out of relying on external treatments or invasive treatments. So the modern science proves that human knew from 1,000 years ago. The ancient scientists, they know that the blood of umbilical cord, which was full of stem cells, could regenerate somebody who's dying. So this is something new. They knew it. I read one of the ancient philosopher and scientists, Persian philosopher and scientist, that would talk about the stem cells. That was 3,000 years ago. So to help the sick person. So the health credit goes to the body's healing power to repair and fix itself, not to the modern lab technology. So we, as human race, we had the knowledge from ancient time. External artificial therapy always fails because it's against the laws and principles of nature, and internal natural therapy always wins. This is something that I can say with conviction. Always, if it's a little bit late, but the winning is always there. So from modern scientific side, I'd like to, bring you my story that how did I get into the world of stem cells to do some research. The modern scientific standpoint, a stem cell is just discovered about 24 years ago by these modern scientists, okay? It was just 2001, then all of a sudden things came out, right? But holistic ancient standpoint, the stem cell has been building, repairing, regenerating human body from a starting moment of life. This is nothing new. But if you want to separate it from the body, take it to the labs, put it in the centrifuging, and separate the platelets, whatever you do in the lab, and then inject it in the body, this is new. This is absolutely new. And it stays new because the body doesn't take it. Human body does not agree with that. So, but again, generally speaking, it's just 24 years ago that it's this exogenous stem cells therapy that called reactive regenerative medicine therapy came along. But endogenous stem cells activation has always been in a natural regenerative medicine in the hands of natural practitioners. So taking out the stem cells from the human body, culturing it artificially in vitro, centrifuging it mechanically to proliferate out of the body, injecting it back into the body with several serious risk factors involved. The answer, why? We can easily activate and proliferate the cells within the body by gentle natural methodology and safe modalities such as homeopathy. Which one are we going to choose? The body does not choose the first one. If you choose it, but the body doesn't choose it. So we are here to help the body. So the activation of somatic cell regeneration process and activation of a stem cell repairing system are two different processes. Activating the naturally endowed human inner repairing process and regenerative power is something that we do at this platform. Okay? So exploring the fascinating realm of stem cells, the human body in a repair and maintenance system. So we are born with a bodyguard, with army such as immune system, with repair system, with regeneration system, with everything. We are equipped. The problem is that the past 125 years, unfortunately, that the medicine has been monopolized by one system of medicine and made doctors to become mechanics and just separating the organs and tissues from each other. And they don't even teach the pathways and collaborations between all these organs and tissues together. So this undifferentiated cells or the stem cells, they have capacity. They are very, very incredible ability and capacity to multiply into 200 different types of cells that form human beings. So let me just explain this to you, that we are born with somatic cells of each organs and tissues. For example, liver, pancreas, kidneys, lungs, hearts. They are all programmed They all have individual cells in different shapes, different function, different locations, and they're all programmed to do so. Nobody would ask them to regenerate. They regenerate. They regenerate on a regular basis, no matter. They regenerate on a regular basis, no matter you are healthy or you're sick. They keep regenerating. If you are healthy, they duplicate new cells that they are healthy. If you're sick, they still duplicate new cells, but they are sick. So that's how, when we are getting in the road of degeneration, this duplication is going to go on and on and on. With sick cells, that's aging takes place. But regeneration of somatic cells would never stop, no matter you have dealing with malignancy, you have dealing with any sort of disharmony, with continuous. So that's why the health span that I mentioned earlier is the key to keep your body healthy. So what was my ignite of my research? It was, as you all know, in 1980s, stem cells in the blood was identified as hematopoietic stem cells, and transplant for cancer therapy from compatible donor was created. It was not long ago. In 2001, stem cell therapy technology as regenerative medicine was newly discovered, which is still controversial, and it's going to be controversial forever. And in 2004, personally, that I stepped into the stem cells to learn more about it and starting researching about it, I heard from one of my patients who was under my care, homeopathic care, was suffering from MS, multiple sclerosis. And they were, but you know that MS is very slow progress in terms of healing. So I heard from her that she asked me, what do you think about if I go to do a stem cells therapy, exogenous stem cells therapy, along with homeopathy? I said, what is it? And she couldn't explain it to me. And that was the ignite of my research, to go and understand what is this exogenous stem cells therapy is. Back then, there was not adequate sources of information or scientific data to back up the claim. Was very controversial and still is to this moment. And after doing some research, what I told my patient that unfortunately I cannot say anything about it. So if you want to do it, it's your choice, but I cannot claim that it's going to work for you. So at that time, what I found about a famous article that turning blood. This is so interesting. When I read these two articles, then I said, what is just turning blood into brain, which means blood cells can make brain cells. And there was another article that they say turning blood cells to liver cells, which means blood cells can make liver cells. So if the blood cells can make liver cells, can make brain cells, so can make pancreas cells too, can make lung cells too, can make heart cells too. There is no bias here or discrimination here. It was very fascinating to learn more about it. That's how it started. It was very, very tiny little articles out there. We did not have Google that massive information, but there was this. But it definitely brings a question. So why not the other organs, such as pancreas, lungs, skin, and the other cells? So this is something that I was very curious to know what's going on with these stem cells. So I'm not going to get into the artificial methods, but let me just explain, which you all know, you're all doctors, but it's just a kind of refreshment for you. and the difference between somatic cells and stem cells. There are two distinct cells. So that's why we have two different regeneration systems. Somatic cells, such as all the organs, they are differentiated, they're programmed, they're specialized, they're automatically renewing according to their program, according to their blueprints and the information that they are born with it. Stem cells, they're blank cells. They're on call. They're undifferentiated, they're unprogrammed, they're non-specialized, and they have to call them. Let me just, I have a model, I always, for my teaching, I have a model to give some, to make it a little bit easier to understand. So, for example, somatic cells, stomach, for example, 2 to 9 days would renew. That's a renewal cycle. Intestine, 2 to 4 days, renewed. Tongue, 10 days renews. Lungs, 8 days renews. Skin, 14 to 30 days renews. Platelet, 10 days renews. These are all programmed. You cannot make it less for them. You cannot make it long for them. These are all programmed. They're specialized. Nobody would tell them or order them, okay, it's time to renew. For sure, if there is a problem such as injury or degeneration, we have to send them a message to renew. That's a time, not when they are going according to the program, but there are times that there's a trauma, there's accident, there's injury, there's degeneration. That's a time that we have to come in between and say, hey, regenerate faster. We need regenerations, but somatic cells cannot do that for us because they are injured. They are injured because of deficiency. They are injured because of intoxication. They are injured because of lack of energy flow. They are injured maybe mechanically. They cannot regenerate. So at this point, we need to get helpers. And who are the helpers to come to become somatic cells for us and regenerate? Those are the stem cells. Those are the stem cells. But again, stem cells are like, they're like saving deposits. You're saving funds. For example, your bone marrow is your bank. It's a bank of stem cells. It's your bank. Let me just give you a model, a comparison model. For example, something happened in your house and it needs quick repair. A flood happens or something major happened in your house and you have to quickly repair it. And you need to get somebody to come to repair it for you, right? And that somebody needs to be paid. What's going to happen? So you tell somebody that, oh, I have savings, but you come and repair? No, you have to go and get the money in your hands and give it to that person. So in a form of digital, you can withdraw the money, or you can personally go to the bank and withdraw the money. This is your funds, and bring it and use it for repair. The same thing with the stem cells. Stem cells are on call. No matter how much injuries, how much problems we have, if you don't call and you don't go and withdraw stem cells from the bank, which is the bone marrow, they won't come to you. They have to be called. Then who's going to call them? Somebody has to call them. There are growth factors. How? By signaling messaging pathways that they create quickly. So how? We do it with homeopathy. Homeopathic medicine is genius to activate the growth factor on the sites of injury, to create a signaling messaging pathways and send it to the entire body that the body needs help. The body needs help. The body needs repair. This is a collaboration. Don't think that the sites of injury only gonna send a message. Send to the entire body. But that's the time that bone marrow is getting the message in opening up the gates, getting to release the stem cells. Okay, let me walk you through that. Somatic regeneration system, which is somatic cells regeneration, they new differentiated cells beyond natural renewal cycle, as I mentioned. New cell from healthy cell, new cell from sick cell. So as I mentioned to you, you have no control on that and no stoppage. They're going to go on and on and on. So, but the stem cells repair system activations, which are the undifferentiated cells, they need to be called for repairing, for healing, and for regeneration. Human body is intelligently programmed for both regeneration processes at all ages, no matter it is infancy or 120 years old. They're all programmed to do things for you. So I call the stem cells RRR, which is repair, replace, regenerate. Repair, replace, regenerate. So they work from the embryonic time. They make a fetus, as Dr. Kumar just said. In child stage, it's for growth. In teenage stage, for maximum growth, height and width. For adult age, is for repair, for replace and regenerate. In adults, stem cells are responsible for the repair of injured or damaged tissues. When we say injured or damaged tissues, aging or degeneration side is included. And the replacement and regeneration of tissue that turn over rapidly, such as skin, blood, lining of intestine. Our system is always in turnover state. It's always, as I said, the renewal cycle, right? In 14 days to 30 days, skin has a turnover. Intestine in 9 days has a turnover. Tongues, it's 10 days has a turnover. So at this point, we need stem cells. So if the turnover goes faster, then it's causing some issues that we have to stop it. If it goes slower, there is an issue. But if the body is in a health span, is healthy, everything goes accordingly. So the ability of division, how they duplicate and how they make new cells are different. So somatic cells make somatic cells. Pancreas cells never makes liver cells. Stomach cells never makes intestine cells. They all make the same cells as they're programmed. But the stem cells makes stem cells and somatic cells. So that's a power of stem cells and the difference between these two. Because stem cells becomes somatic cells when they diffuse in the injury sites. And after that, it regenerates. Because a stem cells does not regenerate on its own. It has to become somatic cells, then starts regenerating. So differentiated cells, somatic cells, and undifferentiated cells, stem cells. They're two distinct cells, but they become one. This is the amazing of how nature is designed human body. So what the stem cells does, what's the function of a stem cells? When we activate the stem cells by signaling messaging system, by growth factors of the sites of degeneration or the sites of injury, first, the message sends to the bone marrow to release, because bone marrow is keeping them, is like a saving bank account, saving account. Nobody can touch them. Only one message can release them. Then they mobilize. Then they migrate to the injury or damage side. Then they become converted to differentiated cells of that tissues. If the skin becomes fibroblast, if the liver becomes hepatocytes, any somatic cells, stem cells becomes that cells. Then repair the cells if it's repairable. But if it's completely damaged, it's going to replace it. If it's damaged or dead, we're going to replace it. That's a power of stem cells. And then becomes somatic cells. Then it starts regenerating. When it becomes somatic cells, if it's, for example, intestine cells, then it follows the program of renewal cycle of the same cells. If it's pancreas, follows the renewal cycles of pancreas cells. If it's liver, liver cells. But prior to that, because it's undifferentiated, it's not going to regenerate itself. So after that, it starts regenerating, healing occurs at that time, then it stops dividing. Otherwise, we get tumors if not stopping, right? So stop dividing. From the beginning to the end, from the activations until stop dividing, everything is moderated, managed, and coordinated by growth factors, cytokines. So this signaling messaging system is saving lives. That's what homeopathic medicine does, to create a signaling messaging system to activate growth factors to go through this process. It does it in every single medicine, in acute, emergencies, keynote, and constitutional, but in different applications, which if I have time, I'm going to walk you through. So the raw materials of human body are stem cells. Our stem cells are the raw materials. So that's why they're blank. They have to be shaped and placed. They have to be walked to the site and comes to the understanding the site and gets the shape of that cells of that site and also function the same. It has a unique ability to repair, replace, regenerate. No cells has this ability, okay? Even though they are born non-specific. So stem cells numbers, that's a question I often asked. I'm often asked about, so maybe because we have less stem cells by then growing older, that's why we degenerate. Absolutely not. As stem cells, when they release, they proliferate. They proliferate like crazily. We don't need the same amount of stem cells when we had it when we were 10 years old or 5 years old. So, but the power of proliferation of stem cells, which in the exogenous therapy, they can see it, that sometimes is very dangerous, can create tumors. So that's the power of proliferation of stem cells. So at any age, we should not worry about the numbers of stem cells, because the moments are released, they proliferate. So, but there is an issue here, because we are born with a red bone marrow, which has millions of, I think, 500 millions of cells. I don't know exactly the numbers, but they're huge numbers. But when we get into decade of 30, 50% of them, are gone, because the red bone marrow becomes yellow bone marrow, becomes fatty. From bloody becomes fatty. So loss of red bone marrow to yellow bone marrow over time is the cause of losing 50% of stem cells in decades of 30s, and many age-related diseases. Repair gets harder. So at this time that we learned, actually at the school they taught us, when they get 30, 35 years, you should not have babies. Your body starts aging. You have to have, this treatment, that treatment, because of just the numbers of stem cells. But there is no reason that the power of stem cells are getting reduced. The numbers getting, because that's enough for the decades. So the only thing that you have to know how to call them. If you don't call them, they're not going to help you. So that's why we say homeopathy can save life, because has a calling mechanism to activate the growth factors. So, as I mentioned earlier about the growing older, so everybody will grow older. It's the privilege to grow older, and but natural regeneration is continues. But getting older is unnatural because it's degenerating. So we grow older, but we regenerate according to the age, according to the needs, because the regenerations also is according to the needs of this stage of life as well. I don't need to regenerate when I was, the same as when I was 14 years old, according to my, stage. But biologically, we're not getting older. I think I have to, it's the secret as well that I always add in my class, but it's more private, that I always say when I test myself with bioquantum feedback, you all, I think you're familiar with that. So every year I'm better than the year before. It's about the health span, but my number is going up. My age, chronological number is going up, but my biological number is getting better. Because I apply what I know. So it's not a secret. You apply what you know. So we are growing older and the body structure is going through changes, and I'm not talking about that. So I love some of my gray hair. I think is a sign of the wisdom, and but does not mean I'm degenerated. So losing a pigmentation of hair does not determine that it's your cellular degeneration. So that's my perspective. And you can have gray hair, but at the cellular level, be intact, no osteoporosis, no muscle atrophy, no connective tissue, collapse. And these are all the signs of, having, regeneration. Okay. Let me just pass. I apologize that I have to quickly pass some of these slides because I want to get you into the. So when it comes to somatic, let me just mention something here. When it comes to somatic cells, so even we call stem cells when we need it. And the stem cells migrated, and diffuse and converted to the somatic cells. But if the somatic cells of the site is already deficient, if that tissue is already toxicated, if that tissue already doesn't have adequate energy, the same stem cells that converted to somatic cell, that somatic cells is still the same. That's a problem. That's an issue here. That's why I created the trinity of the regenerations or anti-aging. My trinity is, I think I passed it, so, to take care of the deficiency, cellular deficiency, take care of cellular intoxication, and take care of cellular inadequate energy flow. I think all my students are familiar with this. They all have my book, and they all know my trinity of the degenerational disease that applies to every single somatic cells. Every single somatic cells, okay? And as I always teach that 92% of the deficiency comes from mineral deficiencies, the structure of the body. So I'm not gonna get into that because I cannot get to the stem cells if I stop at this, but make sure that this trinity applies to stem cell, to somatic cells for regeneration or anti-aging, and also no matter how much active your stem cells are, still they're converting to the same somatic cells that is deficient, is toxicated, and it's having problem with energy. Okay? Mineral is very crucial to our regenerations. Okay, I think I talked about somatic cell regeneration process that goes through mitosis. So we all know that. I don't have to, because this is a course. As I said, it's a 20 hours course. But again, I would like to repeat it. If the mother cell, somatic mother cell is intact, the DNA intact, the daughter cells are intact too. If the mother cell is sick, the daughter cells sick as well. So we have to make sure that at every single moment, we're taking this health span and at the cellular level. Okay. Any questions so far? I can answer one question and then I can continue. Dr. Farbod, if you can give me 10 more minutes, I appreciate it.
Sure, my pleasure.
Any question, or I can go?
Actually, we learn a lot from you as always, and we can't stop. Thank you so much.
You're welcome. So sorry about that. I have to quickly pass some of the slides because time is limited for me. But again, when I talk about anti-aging regeneration, I have to mention both repair system and a somatic system. So we have everything. We have anti-aging regeneration organs, which is our liver, project manager. It's working for us 24 hours. And it's the only organ that if you cut 75% of it, it still works the same with 25%. And is gradually is going to grow back to the original size. It's so amazing. Who can do this? So when you have such a precious regeneration organ, and this regeneration organ also produces two major hormones, IGF-1, that's a great, practically is our anti-aging hormone, and GAG, which is a family of hyaluronic acids. These are hormones that are produced by the liver. So again, back to the emunctories, again, back to the somatic organ, that what they do is incredible. So when we are younger, when we are through childhood and puberty and everything, so we need a growth hormone from pituitary gland in order to make us grow to the maximum growth according to our genetics blueprint. But then it stops, it's reducing. And when we becoming adults, we still need growth hormone, but in a different form, because the maximum growth, it occurred, it took place, but now we need it for different growth of tissues and different, way of growing. So then the body is giving this job to the liver instead of pituitary gland, gives it to the liver. So there is a loop here, and there is a feedback loop here. So when we are adult, that's why we say growing older. When we are growing older, we need growth hormone, but in a different ways, different applications, and different organs. So it comes from the liver. So IGF-1, it's an amazing anti-aging hormone we have. So when we have such an organ like liver, such an anti-aging regeneration hormone, why we are aging? As a question goes back to the trinity of the disease. Aging is not a natural phenomenon. Growing older is. So again, pathway of somatic regeneration and pathway of stem cell regeneration are two different, distinct processes that geniusly is endowed in human body. So let's get into the repair system now. In somatic cell injury, who is the helper to repair, replace, and regenerate? The RRR, which I call it. In adults, stem cells functions are repair, replace, regeneration. So in a case of bleeding, physical traumas, broken bones, accidents, chronic degeneration, cellular aging, cellular distractions, such as cancer, and cellular death, stem cells are on call and need to be reached out through. signaling messaging system, cytokines, upon receipt of the message, repair system in local sites. So for example, the injury happens on the skin. Just assume. So the first, the signaling messaging system first is going to activate the local stem cells. First, the local, such as fibroblasts. If they're not enough, which they're not enough in adults, the local stem cells are not enough. But during the time being that the messaging goes to the bone marrow to release the adult stem cells, the local stem cells is going to do the job, but they need helpers. So at this point, the local stem cells start working until to get the helpers from the bone marrow. And then, because the local stem cells, they become somatic cells as well, but they're not enough. So upon activation of stem cells are released, mobilized, migrate to the site of injury or the site of degeneration. That's the process. So first, the local site, the stem cell is going to be activated to do the job, because otherwise, for example, in case of bleeding, the person is going to die if the local stem cells are not active until the bone marrow releasing the adult stem cells. So the bone marrow, the bank of blank cells, as I mentioned earlier, is like a font, and you have to go and withdraw the stem cells. You have to either, we do it now, we do everything, banking online. So, but somehow you have to call to withdraw. Okay, this is exactly what homeopathic medicine works, by sending information to activate the inner healing ability, vital force, to activate the repair system. We call it intelligent stem cells are activated by intelligent homeopathic medicine to release the saving funds for us. That's the work of homeopathic medicine. Homeopathic medicine does not do the rest. It's your healing power is going to do the rest. That's why don't make mistakes between medications and medicine. Medicine is a remedy. Medication is suppressive. So homeopathic medicine does not cure you. It's activating your healing power to cure you. So it's a process of, as I said, in emergencies, in traumas, in acute, subacute, epidemic, pandemic, chronic, cancer, malignancy, everything. That's the job of homeopathic medicine to do. Everybody has to be a homeopath. So yes, our repair system is on call, and the state of stem cells are a state of quiescent cells. So we have two different states, quiescent state and senescent states. The senescent state is irreversible, means that cells is already dead, and the cells are not active, metabolically are not active. But the quiescent state, the cells are dormant, and they just need to be activated. They're dormant but metabolically active, but they have to be called. So when I talk in my course about quiescent state, it means stem cells that they are metabolically active, but they do not divide until they're called. So until they're called, they're released, they're migrated, and they're converted to somatic cells. Then they start dividing. That's how the process is. So as we know, the bank of adult stem cells is bone marrow, and bone marrow is huge working for us. And that's why we have to keep it healthy as long as we are alive. It's a remarkable ability that these stem cells can do from being non-specialized to become specialized. It's just an amazing. And nobody tells them what to do. They just do it. That's why homeopath never tell the cells how to work. We say, we activate your healing power and do it with yourself. We don't make any man-made rules for human body that works naturally. Okay. I'm going to get into homeopathy now. So when it comes to somatic cells, I want to just mention as a few aging contributing factors, such as cortisol, which I teach it in my quantum anti-aging course. I think all my students know about it. There are some factors that during our lives, is not only during health span, we have to be very cautious about it. Like cortisol in a small amount can in a short duration can be your rescuer, but can be your enemy in large amount because it's blocking the regeneration pathways. So this is something I know that you might ask that, oh, how we can control the stress, how we can, when you're changing your lifestyle, the epigenetic that Dr. Kumar said, the cortisol already comes into a normal state. So because of stress and unnecessary stress that puts you in a fight and flight, state and response, always block the regeneration, no matter somatics or repair system. The same thing with insulin hormones that is teeter-totter with the IGF, with anti-aging hormone from the liver. It's a very same formula. And when insulin goes up, IGF-1 from liver goes low. You cannot regenerate. So that's why it's very important to, keep the body at low stress, and also fasting. Fasting is something that I highly recommend to everyone because it keeps insulin in check and also quality sleep. At the end of my talk, I can walk you through all the, the tips that you can, activate the stem cells with food, with lifestyle and everything. The main culprit to human body is toxins. It's toxins, because homotoxins, exotoxins, endotoxins, every toxin. So toxins is non-self and can replace the cells for life. And this is the main culprit to human body and our regeneration process. Okay, I'm going to go fast from here to get to the growth factors. This is a somatic regeneration pathways that I mentioned, the adult somatic regeneration pathways. So the pituitary gland is that produce growth hormone for the time we need it, and then has the work and job to the liver to produce IGF-1, and IGF-1 is our anti-aging hormone that is in charge of bone growth, muscle growth, skin growth, and everything. So this is the pathways that it's very, very important. Okay, so the growth factors, which the cytokines that I mentioned, stem cells activation by homeopathic medicine, how it works. So as I mentioned a little bit, that homeopathic medicine activates the growth factors. The growth factors that are sitting on the sites of injury, sites of degenerations, okay, to be activated, to activate and to call the stem cells, no matter it is the local stem cells or bone marrow or fatty tissue stem cells. Growth factors are a group of proteins stimulating the growth of specific tissues. Growth factor plays important roles in the regulation of cell division that drives cell proliferation and binds to a specific cell surface receptor. Growth factor regulates a variety of cellular behavior, including growth, migration, differentiation, apoptosis, and survival in both positive manners, such as cell regeneration, and negative manners, such as cancer cells growth. So these are the job of the growth factor. A growth factor defined as a secreted biologically active molecule that can affect the growth of cells, a substance made by the body that functions to regulate cell division and cell survival. Some growth factors are also produced in the laboratory and used in biological therapy, which is out of the scope of my presentations. A stem cells activation can naturally occur by the administration of the right homeopathic medicine as a calling mechanism to create signaling messaging pathway to activate the growth factors. These are all my research. You cannot find them in any books or anywhere. These are all my research that how homeopathy works in terms of stem cells. Growth factors have an array of functions during development and play important roles in the maintenance of tissue homeostasis and wound healing in the adult. Naturally occurring substances capable of stimulating cellular growth, proliferation, and differentiation. Growth factors play a critical role in embryonic growth, cell survival, wound healing in adults. So we have different local growth factors. Now, how homeopathic medicine works. Homeopathic medicine mimicking injury. Homeopathic medicine creates an artificial disease, but more powerful and stronger than natural disease, because according to the natural laws, the stronger force destroys the weaker force. That's a philosophy of homeopathic medicine. So in any form of injuries or any form of degeneration, homeopathic medicine mimicking that. If it's degeneration, is a created degeneration compounds. And homeopathic medicine rings the bell to activate growth factor. Activated growth factor creates signaling messaging pathways from injury site to the entire body. Holistic, works holistically. No matter it's a site of injury, it's acute, or it's just one part of the body, homeopathic medicine sends message to the entire body. The part that needs activation would take the message. The parts that not need activation, just listen to it. Signaling messaging pathways sending information to activate repair system and release of local stem cells, progenitor cells, adult stem cells. So the homeopathic medicine activates these all cells that they are not specialized. Progenitor cells that are a little bit more specialized compared to stem cells, but they're doing the same job. Okay, so homeopathic medicine calling on all of them to come and help us. So all organs and tissues, they have their own growth factors, such as skin cells. They have epidermal growth factor, EGF. Nerve cells has nerve growth factor, NGF. Connective tissue, FGF. Thrombus forming cells, PTGF. And vascular endothelial, VEGF. These are all the names of growth factors that they're localized, and they're just waiting if something happens to that tissues to create a pathways, a messaging pathways for helpers. So you see how sophisticated the human body is. Growth factors have many activities that make them attractive agent for stimulating tissue repair. Growth factor attract stem cells into the wounds, stimulate their proliferation, and have profound influence on ECM, extracellular matrix deposition. Okay, at this point, they will say stem cells have receptors that express various growth factors. So if the stem cell does not have a receptor of the growth factor, they're not going to be released. They have to have a receptor to get it. So stem cells respond to various cytokines by activation of conventional cytokine signaling pathways, which we have it in a form of inflammation. The stem cells are regulated by growth factor in the same manner as immune system, but there are two different systems and two different way of activating. Stem cells and immune system are activated, managed, and regulated by growth factors, both of them. So in immune system, in inflammatory process, they're mounting inflammatory messaging, and for stem cells, they're creating a signaling messaging. So modern science is still evolving to find more about the stem cells. So I don't think so. No matter what, the knowledge is out there. Just download it. So ancient science found it thousands of years ago, but unfortunately, they are hidden. They're hidden from human beings. Dr. Horowitz talked about it in his webinar. It was a fascinating webinar that he talked about it, that how the ancient knowledge has been hidden from human race since 125 years ago, because they want us to be relying on one main stream of medicine. Type of stem cells. So I don't think I have time to go through type of stem cells. Dr. Kumar already mentioned, but let me just get into homeopathy. These are the type of stem cells that you all know from the origin and from the differentiations, and they're fascinating to know. And if we have time, I'm gonna walk you through all of them, but let me get into my talk. Rest of the talk. How much time do I have, Dr.?
Actually, 3 minutes.
Okay, 10 more minutes. 10 more minutes. Okay, the summary of stem cells, that the unique ability, they have a unique to differentiate, they have a unique self-renewal, tissue regeneration, and wound healing. Okay, let's get into the world of homeopathy, how stem cells activation can be done by homeopathic medicine. Homeopathic medicine, homeopathy generally reached this endogenous approach of activation of stem cells 200 years ago. And but again, homeopathy is not a new concept. It's an ancient concept, like cures like. But in 200 years ago, it came to the full-fledged system of medicine. But like cures like or similimum, or this has been a long time ago. Okay. So let's get into the, for example, a skin. Sorry. Okay, for example, for a skin, because we have a lot of dermatologists at the conference. For example, when you're mimicking an injury on the skin, you're calling for stem cells, such as microdermabrasion, microneedling, glycolic peel, fruit acid peel would create micro injury. They're not injury, but the message is an injury. And all of a sudden, the body becomes guarded and starts creating signaling messaging to the fibroblast cells first. And if they're not enough, definitely sends from stem cells, from bone marrow, sorry. Okay. I'm not going to get into principles of homeopathy. Okay. In injury or trauma, homeopathy has different approach. In chronic cases, homeopathy has different approach. So when there is an injury or trauma or acute cases, we're always going to go at the particle level or ground state level, means the low potency medicine but higher repetition. But if there is a chronic degeneration, such as aging, for example, or chronic disease, or autoimmune or malignancy, we go with a higher potency but lower repetition. Is the homeopathic principles. And okay. In my course, I always talk about my model, how constitutional homeopathic medicine works, and how keynote medicine works. The way it works, for example, if there is a house with different rooms, big rooms, small rooms, hallways, and compared to the human body that has organs, tissues, pathways, and how homeopathy is going to ring the bell. So, for example, if the house has a panel, like a main door bell panel, so in constitutional medicine is going to ring all the, all the rooms, the panel is connected to all the rooms, and all the rooms start ringing. So, but in keynotes or acute, the rooms that mostly they need is, they ring, but they are informing the entire body. But again, the part that needs to get the message gets it so fast, but the part that doesn't need to repair, or it's not part of the like injury sites, they watch. They come to help and they collaborate. But I mean, that's how it works. Constitutional rings all the bells, but acute or keynote rings the specific bells. So that's the model that I can talk about it to really understand how they work. Okay, let me get into the okay. Homeopathic medicine carries information mimicking disease, create artificial disease, calling for help to repair. First, activation of local stem cells, local repair system, activation of bone marrow, adult stem cells. So these are the job that they do. And I mentioned earlier that the job is done by the growth factors, and activation of growth factors are the job of the homeopathic medicine. Okay, so for example, Arnica montana, which is our big injury medicine, big injury. They cover the acute. I don't call it acute. I use it even for chronic, for all stages. It's mimicking injury compound, message similar to the injury, but a stronger force. A stronger artificial disease is just information, not natural disease. So as I mentioned, according to the laws, the natural laws, a stronger injury information removes weaker one. So what Arnica does in injury, trauma, contusion, falls, in burn, bruise, bleeding, in concussion, in aftermath of a stroke, which I use it a lot, calling for growth factors. For a skin, call the fibroblast growth factor, FGF, and activate mesenchymal stem cells. And in burn, bruise, and bleeding, call again epidermal growth factor, EGF, and that calls hematopoietic stem cells in bleeding. In aftermath of a stroke, for example, it calls the platelet-derived growth factor, PDGF, and vascular endothelial growth factor, VEGF, and nerve cells, nerve growth factor, NGF, and activating local neural stem cells. So if you see that one medicine, one homeopathic medicine, one injury medicine works in different part of the body with the different conditions and calling different growth factors. If it's a skin, this, if it's a nerve, is this, that's how it works, okay? So I'm gonna get into the Arnica montana, call for growth factor to activate stem cells, release, proliferation, mobilization, migration, and penetration into the injured tissue of a skin to repair and reparate. For example, in a skin injury. Okay, Arnica, we use it in injury, trauma, cerebral accident, post-surgery, and post-operation. For dental work, anything that can cause tissue damage, we use Arnica because it calls a lot of different growth factors. We can get into one of the constitutional homeopathic medicine. As I said, it's ringing all the bells. and because it is chosen according to the totality of symptoms and based on individualization and simillimum concept. And this is very powerful. And for example, argentum nitricum, one of the polycrest, which work covers so many areas of mental, of generals, and neurologicals, head, throat, chest, stomach, extremities. It covers wide range of neurological disorders, great range of digestive disorders, and great range of musculoskeletal disorders. When we say polycrest, means it covers a lot of aspects of human body. So argentum nitricum calls for specific factors to activate in neurological disorders, to activate nerve growth factor, NGF. For digestive system, calls fibroblast growth factor, FGF. And for neurological disorders, release of works on neural stem cells. And for digestive system, works on mesenchymal stem cells. Okay, in musculoskeletal disorders, works on fibroblast growth factor and stem cells in adult stem cells. And that's how constitutional medicine works. The only thing that we want the medicine to do for us is to activate growth factors and our healing power. Okay, I think I'm going to stop here. If I have a lot more to say, but maybe at 1:30 I can continue, maybe like 10-15 minutes. I can walk you through how the medicine works and to introduce you some of the medicine that can do beautiful job in malignant cases.
Thank you so much. Dr. Zareen, we learn a lot from you. As always, your insight and awareness which shine from your knowledge create hope, and this is so beautiful. Where, for example, you mentioned about the reduction of bone marrow cells after age 30, but it is not a big deal for degeneration and aging because aging is not a natural phenomenon. The important thing is power of proliferation of the stem cells, of which is huge. It was a good point.
Yeah,
A lot of good point, and yeah, I like to mention it again. And yeah.
Yeah, it's a huge course, as I said. It's a 20
Yes.
hours course, and I have to summarize it. But I mean, I just give you the key points and what we have and what we can do and who we are and what the human body is. So no aging. Aging is not for us. We don't, and I can challenge people that they say we have aging genes. We have anti-aging genes, not aging genes. Aging is the degeneration. We're not supposed to die degenerated. Even the dead people, I don't know if you have heard that or you have seen it, even for 3 months, they're still regenerating. Their nails are growing, their hair is growing. There are some dead bodies that they don't bury them, for some reasons. And they go back and they see the nails are growing, the hair is growing, the skin is growing. It means regeneration even happens after death. So why this all coming to the people's mentality that aging is natural? Absolutely not. Growing old is natural, and we are growing older. Thank you so much. Thank you. I appreciate what putting up with me. And otherwise I talk and talk and talk. Thank you so much.
Thank you so much. And we have one question. Yeah, thank you, Dr. Fajriani, for your question. She said, what do you think about blood transfusion in life-threatening cases in ongoing massive blood loss? Do we have time to signaling the stem cell to repair, replace, regenerate? Or do you see any blood products in transfusion as toxin?
Okay. First of all, I'm not an allopath to have any comments on that. But in a severe bleeding, we salute the allopathic model if they can save life. but not necessarily to be relying on that, on just blood, what you call it, infusion. Along with that, we can work on the hematopoietic cells as well with our natural, approach. But if the worst comes to worst and they have to do it, they have to do it. So I cannot go against that if it's a life-threatening situation. So that's why I personally always say, in a life-threatening situation, which maximum is 10% of life, an allopathic model can save lives. 90% allopathic model cannot, and they don't have solutions. But in that 10%, if it's bleeding is the case, I'm not against it. I don't know if you mentioned this or you. Hello?
Yes. Okay, thank you so much. If there is any question,
I don't know, the Dr.
Dr. Fajriani.
Did I understand the question correctly? Did I answer it?
Yes, thank you, Professor Zarin. Sorry, I have a bad Wi-Fi connection. Oh, yeah, Dr. Fajriani answered. Yes, thank you.
Okay.
Okay.
Okay. So every model, every system has its own place. Okay. So emergencies is emergency. Dr. Farbot was a medical doctor at emergency room. She knows, she can answer this maybe better than I do. But I mean, but she's becoming a homeopath. Why? Why? Because how many times in our lifetime we have severe bleeding, or we have accidents, or we have this or that? It's, it's not all the time. So, but the human body needs attention, needs activations all the time. So, that's why homeopathic medicine is for 90% of the cases, and allopathic is for 10% of the cases, which they can save lives both.
Yes, actually, that emergency field in allopathic medicine is a field that is so good for managing traumatic situations. So that's why I attend that for several years, for more than 20 years. And there are a lot of way to control bleeding. One of them is blood transfusion, and fortunately, there are a new technology for auto transfusion that get blood from the patients. For example, in massive internal bleeding in operation room, they take all of the blood and put in the auto transfusion machine, and again after cleaning, they transfuse it to the patient. That is not any toxic for the patient or from another person or something like this.
Mm-hmm, mm-hmm. So again, when something works, right? But if it's something damaged, we don't go for it. So thank you so much for everyone who listened to me. Sorry, it was very quick. For me, it was quick.
Yeah, thank you so much.
Okay.
Thank you.
But if you want to have the full course, come to the.
Thank you for your energy and efforts and all of things that you're sharing your knowledge with us. Thank you so much.
It's a lot of depth of knowledge. So these are all my research and, through my practice and acknowledgement and everything. So
Excellent.
yeah, thank you so much.
Thank you. Thank you.
For everything. Okay.
And now that's the time for a research article presentation by a scholars class of 2025. Please let me ask Dr. Angie Otami, coordinator and moderator of research presentation, to start introducing their presenter. Dr. Otami. The floor is yours.
Okay. Thank you. Good morning, everyone. Thank you. I'm truly honored. Thank you for Professor Zarin to welcoming us to this Quantum Academy, Web Quantum Academy. There was a very great joy for me and to serve as Indonesian student as a moderator tonight. And for tonight, we embark this our journey to understand how the aesthetic and anti-aging medicine truly begin from the very essence of human nature to our original fitrah. So it is through recognition with this phenomenal nature that we can offer not just only beauty, but real, the meaningful health and vitality to our patient. So I think maybe we can, thanks to all the presentation, the participant, and all college for all your enthusiasm and contribution tonight. This is very inspiring to witness the passion of the research, innovation, and collaboration among us. So as we move forward, let us remember that every small step we take in this research and this module and integrative medicine as a foundation for a greater change, for our patient, for our nation, and for the future anti-aging and aesthetic medicine in Indonesia. So let's continue to innovate, to lead, and to serve with the purpose. And together we can create a brighter and healthier future. So let's move forward to one number presentation. Number one is Dr. Melissa. Please, the time is yours.
Thank you, Doctor. Good morning, Dr. Parvin and all of the doctors here. I'm glad to be here. I will to start my presentation. Wait a minute.